Hello, my name is Thomas, and this is week 12 video. I completed 100 questions on UWorld and 85 questions on Kaplan. So the first question that I missed, the question is, the nurse in the emergency department assesses a client diagnosed with burns. Which observation most concerns the nurse? So the answer choices are redness and swelling with fluid-filled vesicles noted on the right arm. Shared waxy white appearances of the skin and the left leg, reddened, blotchy, painful areas noted on the trunk, and blisters and blanching of the skin noted on the back. So I chose reddened, blotchy, painful areas noted on the trunk because I assumed, well, for burn patients, I always worried about airway because of the ABC, so airway, breathing, and circulation. So because it's at the trunk, I assumed like the trunk of the body, and maybe I was just assuming the patient had a lung injury. Therefore, I chose that. But this type of description is a superficial burn, so the healing will occur without even treatment. The correct answer was the charred, waxy white appearance of the skin because it describes a full thickness burn, and this is when the skin is destroyed and the muscles and bone may be involved. Um, and then the substance that is describing the white waxy um, is the escar, which is just dry. So yes, and then one of the things that for future note for during assessing for lung injury with burns, I would just assess for blisters and edema around the mouth and nose. Look for soot, especially around the mouth and facial hairs, hoarseness, difficulty breathing, stridor, dyspnea, and wheezing. And yeah. So the next question is, a client with a previous history of transfuse related acute lung injury or TRALI requires another transfusion of red blood cells. Which intervention will the nurse use to prevent a recurrent TRALI? The answer choices is pre-medicate with intravenous diphenhydramine, transfuse with RBCs over 4 hours, request for leukocyte reduced red blood cells, or give supplemental oxygen during transfusion. So I chose the last one, give supplemental oxygen during transfusion, because I'm not gonna lie, I did not know any about, and like I just assumed it was something that you could just like prevent by giving oxygen. I didn't know that there was such thing as leukocyte reduced red blood cells. And then the transfuse over 4 hours didn't seem correct because I know they have a expiration date. And then the diphenhydramine also didn't think it will prevent. But the correct answer was request for the leukocyte reduced RBCs. And because the client had experienced a transfusion reaction, I should notify the nurse or the healthcare provider. And then what this type of blood product is a leukoreduction, which is a process in which the white blood cells are intentionally reduced in blood products to diminish the risk for adverse reaction. So this was an interesting one. I didn't really know much about leukocyte reduced RBCs. So the next question is a delegation question, and I usually struggle with these. The nurse from the ED floats to the surgical unit. Which client will the charge nurse appropriately assign to the ED nurse? So it's a select all that apply. The answer choices are client with a new diagnosis of heart failure to be discharged in 24 hours, client who had a cholecystectomy 6 hours ago, client who had a stroke 3 days ago and requires a total care and enteral feeding, client admitted with pneumonia and requiring IV antibiotics, and lastly, a client admitted with anemia and requiring blood transfusion. So I chose a client newly diagnosed with heart failure to be discharged, and a client admitted with pneumonia requiring IV antibiotics. Because he seems to me um, not as hard for the nurse to be in a surgical unit. Like, they're able to give information or have information based on these patients, but the answer choices were a client who had a stroke 3 days ago, a client with pneumonia, and then a client admitted for with anemia and requiring blood products. Because you want the patient or the nurse to have stable clients with expected outcomes. So yeah, thank you so much. This week I learned what I should focus on is more on delegations. So yeah, thank you.